Development of national health insurance in Indonesia, which I think has been an enormous step forward, but with complications. So it's an honor to us that you decided to make one of your, I know it's a short visit here, and that you decided to join us at Harvard, and welcome. Selamat datang. Dan silakan.
So it is my honor that I'm invited to deliver a speech on here on the Indonesia's new national health insurance program, history, progress, ethical challenges, and implementation and practice. So, as mentioned by Prof. Byron, that I was involved in developing this health insurance or social health insurance, or we call it national health insurance, or now we call it universal health coverage. And Indonesia, as a member of Foreign Policy and Global Health Initiative country, the time also together with these countries to develop UN Universal Health Coverage Resolution draft. And I was lucky because I represented from Indonesia. So this is the critical success factor for Indonesia. Actually, if you can say it is success, but success or not success, then we can see it. But now the problem is, again, we are, have challenges, many challenges. For example, like the deficit, but leadership, political commitment, creating facility, critical mass of experts and stakeholders interested in national health insurance. We still have a few people actually who are expert in this, system. Technical capacity and system design implementation, learning experience running different schemes of the past, preparing for enhancing health structures, especially in remote area, human resources for health and health insurance, education, advocacy, and awareness of various stakeholders. This, again, a little bit problem. So our conclusion is that it is our responsibility to shape better world by implementing global commitment on sustainable development goals, especially goals number 3 and number 4 at least, so good health and well-being. So developing and implementing universal health coverage is a promising tool to achieve this goal. So everyone, everywhere, should have access to quality healthcare without facing financial hardship. And as we know that there is no one size fits for all for universal coverage. Therefore, it depends on the country itself. So it depends on the philosophy, history, commitment, resources, capacity, and implementation of the country. US, I think, with higher resources, should be easier to achieve universal coverage compared to Indonesia. However, lower resources, again, and capacity like Indonesia should also be able to achieve universal coverage. Both in rich and poor countries, universal coverage will bring huge benefit actually, not only for health but also the economic situation.
But suddenly now the primary healthcare system is being asked to do tasks it never did before, to deal with mental health, to deal with tuberculosis, to deal with heart disease, to do real triage, etc., often with physicians who have, and with a whole healthcare system that was not designed primarily to do that kind of work. It seems to me that there's now a tremendous challenge in building the competence at the primary healthcare level to serve this whole system.
Yeah, I think you're right. It is really challenged because now this system is really rely on the primary healthcare. In fact, the primary healthcare was not designed to solve all the problems.
Right.
Suddenly, again, like the psychiatric diseases should be solved in the primary healthcare. In fact, Indonesia now, the doctor or primary healthcare physician have to able to solve 155 diagnoses.
Right.
In fact, in the medical schools, not yet matching of that,
Right.
because that time it was not again designed. It should be only for promotion, prevention, and some mild diseases. But so again, I think it is challenge. And now we are developing primary healthcare curriculum and primary healthcare study programs to keep up with the need and development in the new task of primary healthcare centers.
The top 10 death-causing diseases most likely are chronic diseases which are related to behavioral health issues. Is Indonesia is going that way, or?
Yeah, I think of course Minister of Health and District Office have limited. So they are now, for example, like trying to register type of healthy behavior. So how many people are smokers, and then they are following and trying to change the behavior. But again, it's not done by health insurance scheme, but it is by Ministry of Health and the District Health Office.
You mentioned earlier about some health technology assessment, and that's to look at new drugs or new interventions that's going to be implemented in Indonesia. What about the current interventions that are already out there, that's already being implemented in Indonesia that we know for sure it's not cost effective?
Health technology assessment, it is very important, and now we are developing, although we still trying to develop the human resources expert and the health technology assessment, and now we are developing also the online course for health technology assessment. But for the existing cost effective procedures or techniques, there is already implemented. So now we are started those who technology or new drug which will enter to the system. But if they already enter to the system, I think we can do nothing, but maybe in the future.